Good morning, everybody, and a special good morning on this very beautiful autumn morning. Those of you who expected terrible weather in Dublin are probably nicely surprised this morning, as was I must admit. Can I just start by saying a very big thank you to the wonderful student outreach team. It is just so encouraging and uplifting to see such an enthusiastic group of people starting out in their careers in international and global health, whereas there are some of us probably coming pretty close to the end of it or further down the line. A very special thanks to Delroy for a very touching and meaningful poem. Delroy, thank you so, so much. I am delighted and honoured to be here today to open the Irish Global Health Network Conference for 2024, with its focus this year on advancing health equity. I wish to thank the Irish Global Health Network for organising such a wonderful programme over the next 2 days, as well as the co-hosts, the Institute of Global Health at the Royal College of Surgeons of Ireland. Ireland's International Development Cooperation proudly supports both organisations and the key role they play in bridging the national and the global within the health sphere towards the achievement of greater health and well-being for everyone on this planet. This year's conference covers a range of important topics, as Nadine has said, many of which lie at the heart of Ireland's work in global health, from health system strengthening, promoting gender equality, sexual and reproductive health and rights, climate change, humanitarian crisis, and response. The conference also seeks to underscore the critical importance of a partnership approach to working with our partners in the Global South to reduce health inequities and improve health outcomes for the most vulnerable. Partnership is central to Ireland's approach to development cooperation overall, including its support for global health. Ireland is especially committed to strengthening our interventions in global health to reach the furthest behind first, to reach the most vulnerable people in our world, particularly women and girls, including in humanitarian settings. Across all health interventions, emphasis is placed on health system strengthening and equitable access. We are committed to the inclusion of marginalised groups such as people at risk or living with HIV and persons living with disabilities. Many of you will know that global health is a key policy priority for Ireland's international development policy. It continues to prioritise the improvement of maternal and child health and nutrition, but also contains an important commitment on sexual and reproductive health and rights, along with a sustained focus on addressing the epidemics of HIV, TB, and malaria. It is encouraging to see important positive results have been recorded since 2015 against targets for SDG, health and well-being for all. Globally, 146 out of 200 countries have already met or are on track to meet the SDG target to end preventable deaths of children under 5 years of age. Maternal mortality rates have dropped by 1/3 since 2000, and effective HIV treatment has cut global AIDS-related deaths by 52% since 2010. However, access to essential healthcare services has stagnated since 2015, meaning we are off track for universal health coverage. Furthermore, antimicrobial resistance, the rise in non-communicable diseases, air pollution and climate change, and pandemics and disease outbreaks are amongst the growing challenges to securing health for all by 2030. At a global level, Ireland is supporting global health through a series of strategic partnerships focused on the prevention and treatment of HIV, AIDS, tuberculosis and malaria, the protection of health in emergency settings, and the achievement, as I said, of universal health coverage. Ireland is a founding supporter of the Global Fund to fight AIDS, tuberculosis and malaria, the Global Fund as we know it, and has contributed over 316 million since 2002. The Global Fund provides 28% of all international financing for HIV programming. And Ireland's current pledge is for almost 66 million up to 25 period, more than 30% of an increase on the previous period. Ireland has also funded UNAIDS since 2001. A multi-annual commitment was signed in 2023, in which Ireland pledged up to 10 million for the period 23 to 26. Ireland also works with civil society partners, such as Frontline AIDS, to advocate for the rights of those living with HIV and AIDS, who are often amongst the most marginalised of society. And I am pleased to see representatives of both UNAIDS and Frontline AIDS here today. The last decade has seen an exponential rise in humanitarian needs. Crises are more frequent, more protracted, and more complex. Conflict continues to be the main driver. Currently, there are at least 41 ongoing health crises around the world, with an estimated 166 million people requiring urgent health assistance, according to the WHO. Reducing humanitarian need is one of the 4 policy priorities of Ireland's international development cooperation. Ireland's contributions to health and emergencies include support for measures to protect and sustain primary healthcare services, with a particular focus on securing access to sexual and reproductive health and rights in crisis settings, including maternal and newborn care, and the prevention and treatment of sexual and gender-based violence. Our primary partner for health and emergency is the WHO, with funding provided on an annual basis, including for crisis-specific humanitarian operations, including, for example, in Gaza and the Ukraine. Health humanitarian settings are also supported by contributions through partnerships with UNFPA, the International Federation of the Red Cross, and the International Red Cross. Civil society partners, including Goal and Concern, who are participating in this conference today, are also important partners for health programme in humanitarian settings. In both our domestic and international policy, Ireland is committed to advancing women's and girls' access to comprehensive sexual and reproductive health and rights as an essential aspect of achieving gender equality and improving women and girls' health outcomes. Our new SRHR initiative, approved by the Taoiseach, retains a focus on areas where Ireland has been active in sexual and gender-based violence, maternal health, and HIV. But we are also expanding partnerships to reduce unmet need for family planning, to reduce unintended adolescent births, and to increase the number of countries with laws and regulations that guarantee women and girls access to sexual and reproductive healthcare, information, and education. As part of this initiative, we are scaling up support to reduce unmet need for contraception amongst adolescent and young women, including in crisis settings. Today, 15% of the world's population lives with disability. An estimated 80% of this number live in developing countries and in areas with high risks of natural disasters, armed conflicts, and emergencies. People with disabilities can face very significant barriers to accessing health services due to stigma, discrimination, cost, or even simply not being able to avail of transport options to attend clinics. The increasing level and severity of conflict in places like Sudan, Ukraine, and the state of Palestine is resulting in a sharp increase of life-changing injuries, such as the loss of a limb or newly impaired hearing or sight. This is driving an increase in the need for specialised and intensive rehabilitation services, care, and technology. While we recognise the many challenges to universal health coverage, including the escalating burden of non-communicable diseases, including mental illness, Ireland remains committed to achievement of universal health coverage by 2030, including through sustained support for health system strengthening through multiple partnerships. We believe that expanding universal health coverage will be fundamental to the attainment of global health targets and is imperative for pandemic preparedness. The pandemic solidified our understanding that health is everybody's business. Therefore, there is simply no other option but to renew our efforts and commitment to enhanced cooperation and global solidarity to strengthen health systems nationally and internationally for everyone. This is not only because it is the right thing to do. It is necessary to secure our shared future. Global health is a shared interest for all countries, critical for ensuring not only the attainment of SDG 3, but essential for global solidarity, stability, security, and prosperity more broadly. Ireland continues to support efforts towards reaching the SDG targets for 2030. Finally, and before I finish, I wish to reiterate my sincere thanks to the Irish Global Health Network and to the Institute of Global Health, the Royal College of Surgeons of Ireland, for inviting me to open this important, very important conference, and what promises to be a most inspiring one. Thank you.